Hi, welcome on this new video of Magic Ovaries. Today we will talk about abortion. How is it made? How does it work? What are the criteria to undergo this procedure? I had the pleasure to interview Jutta Pliefke, that is a gynecologist working with Pro Familia, that is the biggest NGO working on reproductive health in Germany. You can find them around Germany and they've been super active for decades to fight for reproductive health rights and promote sexual health. Before we jump to the interview, I wanted to let you know the latest news of Magic Ovaries. First of all, now I have more than 100,000 followers on my French account on TikTok, so thank you very much. I don't know if you also speak French. If you do, please check it out and join the community. Big announcement, I don't know if you saw it on social media, but I have created this beauty and it is now available on my website. That is the Ultimate Menstrual Diary. This agenda allows you to track your menstrual cycle by monitoring your body basal temperature as well as your cervical mucus. It costs €29.90 and it is available in French and English. And this small agenda will allow you to track your menstrual cycle over 4 years. That's enough talking for me. Let's jump to the interview.
Well, she has to make up her mind at some point, not immediately, but like within the next 3 months, if she wants to continue the pregnancy or if she's going to opt for an abortion. Yeah. And we try to help her making the decision. Lots of women who come here have made up their mind already, and then we give information and explain and try to take away the worries and the preoccupations. And we have a list of doctors and we can explain which doctors offer which opportunity. But basically it's a big decision to make, which might take some time, and we try to help. Once the woman has made up her mind, or is as clear as she can be about not continuing the pregnancy, depending on the length of pregnancy, she has 2 options. She can either go for a so-called medical abortion, which means taking pills, which will eventually make the bleeding, which is very much like a sort of delayed menstruation come, or she can choose to have an operation. And if the pregnancy is more than 9 weeks, calculating the German way, which might be a little confusing because the German way is calculating the length of pregnancy starting with the first day of the last menstruation, and the pregnancy starts 2 weeks later. So it's either 7 weeks counting from the actual start of the pregnancy or 9 weeks like the German calculation. And if it's more than that, then it has to be an operation, which is no problem really. Well, it's very much the same everywhere. It's a very international way of treatment, and the medication is basically the same wherever you take it. It's 2 types of pills with 2 completely different types of substance. Yeah. The first pill is taken in Germany, that's the law. It's taken at the doctor's place. The doctor has to watch you taking the pill, or it's normally depending on the dosage, 1, 2 or 3 pills you take. And then the woman can go home, she can go back to work. She won't really notice all that much because it takes a little for the pill to work. And what the pill is going to do is it's going to block the hormonal receptors. Yeah, so these are blocked, and then the hormones can't really work anymore. So it's very much like the hormones aren't there anymore. Yeah, and this makes sort of the tissue starting to get loose inside the uterus. And then 2 days later, after this has sort of continued working, the first pill, there's a second type of pill taken either at a doctor's place again or at home. Lots of women prefer to take this second type of pill at home. And this pill will make the uterus start working to try to push the loosened tissue out, and then the bleeding will start, normally after 1 to 3 hours.
Okay.
And that's sort of the thing the woman will notice then. She'll have her bleeding.
Okay.
Yeah. No, it's nothing that's naturally produced, and it's sort of the medication that's really gonna sort of do the abortion itself. Yeah, the second pill is sort of helping along, yeah, because we want the woman to have this bleeding in a sort of controlled way. Most women prefer the bleeding to start as soon as possible to get this over and done with, but the abortion itself is happening with the first pill, and once you've taken it, you can't make it go back again. This depends on the length of pregnancy, and it also very much depends on the situation, on the person. It's not the same for everybody. Yeah, but as the tissue has been building up longer, yeah, it's important to understand that the tissue that's bleeding out when you have your medical abortion is the tissue that's been built up completely from scratch every month. So basically what happens when you have your regular menstruation is like the body has been building up this tissue for 4 weeks, no pregnancy is happening. This means these hormones sort of drop, and then the tissue is loose and it starts to come out, and that's your menstruation. When you're pregnant, then the tissue is staying inside your uterus longer, and it continues building up for a longer time. Yeah, and when you have the medical abortion, all the tissue that's inside your uterus has to come out. Yeah, and it's more tissue. Yeah, so the bleeding will be heavier in most cases and will take longer in most cases.
Okay.
And we talk to, or women come and talk to me, and some say, well, I had a bleeding that was very much like my menstruation, really no problem whatsoever. Yeah, and then there's women who say, oh, my bleeding was so heavy and so long. I never bled like that before in my life. And most women are somewhere in between. Yeah, so it's good to prepare yourself for a strong bleeding, which is going to take like 1, 2, 3, 4 hours, not longer. Then it's going to go back to normal, like your regular menstruation, and then it becomes less and less and less and less. But it will also, in most cases, take longer than the normal menstruation, meaning like maybe a week or 10 days. But in the end, it will be a very light bleeding. It won't be a heavy bleeding for such a long time. No. In most cases, there's no embryo yet. The embryo starts developing in the 7th week of pregnancy. It's not there before because the body has to prepare before. It has to build up the tissue. Then the little sac has to develop, which has to grow and have a certain size. And then the embryo will start developing. And in the beginning, it's more like it's a sort of it's muscles which start pulsating, but it's tiny and it's very soft tissue, yeah. And within these 2 days between the first and the second type of medication, it will dissolve, yeah. But what women will see is that there's more like this endometrium tissue, and she will see there's more clots, yeah. It will be like a heavy menstruation, which most women know. Well, we always offer women to come back here if they feel like they need a place to talk about it. They feel like that this decision they've made, or the process, or things that happened afterwards, like, I don't know, whatever happens in the partnership or in life, is more. They think more about it than they are prepared, or they knew before. So women can also come and talk about this. Some come like years afterwards, at some point in their life, when they feel like, oh, I want to look at this time of my life. But most women don't come back. And most women come back here for other reasons, or they come back because, I don't know, they're pregnant and want to talk about methods of other issues in pregnancy. And most women say, well, of course, it's not an abortion, it's something very special in my life. Of course, I'm not going to ever forget this happening, but it's not something that's really sort of very difficult for me. Yeah, and it makes me able to lead my life in a way I chose. Yeah, and some women say, oh, to make this decision about myself made me stronger, or might be clearer about what I want to do and how my life should be. Yeah. And we have huge studies on this, because abortion is a very, very frequent procedure. It's the most frequent gynecological procedure in Germany, in most other countries. So we have huge information on this, and we know that most women don't have psychological problems afterwards. Or we also know that women who continue with a pregnancy in a difficult situation have more psychological issues than women who chose to have an abortion. Mm-hmm. But of course, you can't say this for, like, every woman is different, and it's very important really to look inside yourself and have a feeling for what is my way. Right, the second type of abortion is the operation. That's important to know. It's a very small operation, it's a very safe operation. There's no cutting, there's no sewing, there's no permanent alteration of anatomical structures, there's no way of knowing afterwards, no gynecologist, nobody could see if a woman had an operation for an abortion or not, because what's going to happen is that the woman is given a medical preparation before, which is exactly the same pill like the second pill in medical abortion, which sort of starts dilating the cervix a little and makes it softer, yeah, and sort of makes it easier for the gynecologist to enter the uterus. And then in most cases, the woman goes for general anesthesia. You can also do abortion in local anesthesia, but most women choose to have general anesthesia. And so once the woman is completely asleep and doesn't feel anything anymore, then the doctor sort of opens the cervix, dilates the cervix with instruments until it's dilated enough to insert a tube. It's a very soft material tube, and this tube does what sort of the body does itself when you have a medical abortion. It sucks out the tissue inside the uterus, which is the endometrium with the maybe bulb and the embryo inside. So you sort of suck out, and it's only the part of the endometrium again which the body creates completely new every month. Yeah, so there's no permanent alteration as well. Mm-hmm. The curettage is sort of the old-fashioned method, and WHO and all sort of gynecological societies are very clear that that's not the method of choice. Yeah, the method of choice is the suction, because the curettage has a lot more risk of harming the tissue inside the uterus. But Germany is old-fashioned in this way, and there's still places where people, especially in hospitals, for instance, where they don't have the sort of the suction things, or some doctors, or I don't know, still use the curettage. So it might be a very good idea for any woman who goes for an operation to ask exactly how is this going to be done. Yeah, and okay. I really want to have the suction. Yeah. Okay. And then if that's not possible at this place, then go and look for somebody else. Yeah. In medicine, there's never 100%. It just doesn't exist. Yeah, and there is no operation with 0% risk of of adverse effects, of sort of things happening that nobody planned. The risk is very, very, very low, yeah, but it's not zero, yeah, but it's very low, yeah. It's almost zero, yeah, which means that normally, in most cases, it's no additional risk if it just happens in your life that you have an abortion and then you have an unintended pregnancy and go for an abortion again, yeah, and we see women here in this situation, and at least we can tell them, oh look, your fertility is not changed. Yeah, you didn't want to be pregnant. Most women use contraception and still become pregnant. It happened to you, so see, there's no problem with fertility. And if you have another abortion, it's going to be the same. Well, we talk about this. And the doctor who's going to do the operation is going to talk about this as well. And there is sort of a legal situation that a woman has to read certain information and has to sign that to say, oh, I know I choose to do this. I know the doctor had told me about possible problems. And there's also always a very, 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 very small possibility of sort of hurting the uterus. It's very small, but it's not zero. There's always a possibility of a very heavy bleeding. When you have an operation, there's always a small possibility of an infection. And of course, you have the anesthesia, so the anesthesiologist is going to talk to you as well. It's an abortion is a very short and medically speaking, very, very small procedure. So also the anesthesia can be very shallow, very short. Yeah. And so the risks are very, very small. But of course, you always have the possibility of an allergy happening, of whatever happening. Yeah, it's never zero. But what's the option? Yeah, when you stay pregnant, the risk is so much higher for everything. Yeah. There's no when you're pregnant and you need to give birth, yeah, you have a lot of risks for things to happen. You go in for the operation, then it's usually like you change. You're told before what you're supposed to bring and how you're supposed to dress. Then it's important to know that because of the anesthesia, you can't eat or drink or smoke before, but you're going to be told how to handle this. You can brush your teeth, yeah. And then you're going to wait for your turn for the operation. You walk normally. It's like this. You walk inside the operation theater because you're not ill, you're not sick. Then you sit on a chair that's very much like a gynecological chair, and then you lie back and you with your legs put up like this. And then the anesthesiologist is talk to you again. Okay, so we start now, and then she's gonna put a needle inside one of your veins, and then she's gonna give you an injection with medication, and then you're gonna sleep. Yeah, and then you won't notice what's gonna happen. And when you wake up again, normally it's all finished. You're in a regular like bed or sitting on the chair already, and then you're going to stay at this place for an hour or two to make sure everything's good. This is basically because mainly because of the anesthesia, not because of the operation, but there's sort of rules and regulations concerning anesthesia. Also concerning that you're not allowed to travel home by yourself. Afterwards, somebody needs to pick you up, or you have to arrange for a taxi. And then you go home, you lie down, you will be a little tired, but basically you won't really feel all that much, and you can go back to work and do whatever next day. You can do this until, after this German way of calculation, until 14 weeks, which means 12 weeks of pregnancy. And then that's German law, which we hope is going to change, but not now, not already. And then this option is called option after counseling. It's still illegal. It's in Strafgesetzbuch, in penalty law, which means it's illegal for the doctor who's going to do the abortion, never for the pregnant woman. She doesn't have any problems, but the doctor has to make sure there are certain regulations and everything is covered. So the woman has to go to an official counseling center like Pro Familia and talk to an official a counseling person who has a certain kind of training. There's no real regulations about how this is going to take place, and we say the moment sort of the person has sort of entered this room or talked to somebody, said hello on the phone, or I saw her via video, that's okay. But in most cases, it's a longer conversation, because we also try to make sure that the person has all the information she needs. She knows who to go to. She knows about financing, and she can talk about her fears or her whatever she's worried about if she wants to. And then she gets a certain piece of paper called Beratungsschein with a signature and stamp from the counseling center, and there's the name of the person and the date of the counseling, because that's the second regulation. After the counseling, the doctor can do the abortion after 3 days. So the doctor has to check the date and make sure there's 3 days between the counseling and the abortion itself.
Okay.
And this possibility goes until 14 weeks or 12 weeks actual pregnancy. And then it's from one day to the next, it's over. Not really, because with the suction method, and in lots of cases there's no embryo yet. And with the suction method, you have sort of an apparatus and you have a lot of tissue, a lot of material, from the abortions, and there's sort of the embryo inside. And the embryo is not like we imagine it to be, like sort of something like, I don't know, a firm. It doesn't have bones yet. You could always talk to the gynecologist about this, and of course there's options for lots of things, but it's not something that's so important for most women, But it might be, especially if the woman's sort of sometimes it takes a long while to decide, and sometimes sort of both ways are very close together, and then it might be important to have a ritual. And we always talk to women and say, well, you can say goodbye to this pregnancy in a sort of loving way. It doesn't have to be the idea of something so cruel or brutal. You could just, you never wanted anything bad to happen to this pregnancy. You don't. You can love it. You can be happy to be pregnant. You can be proud. You can be lots of things and still choose to have an abortion. And then you can sort of have the idea of saying goodbye in a loving way. And some women say, okay, I need some. For instance, also it's the same when women have taken the second medication for medical abortion, and then the bleeding will come and the tissue will go away from them. Some women say, well, I want to have a candle, or I want a picture of a person I love, or I want to listen to a special song, or sort of, and I want to cry and be sad about this, knowing that that's just the right choice for me. But still, it can be very sad. It can come back as soon as after 10 days. So it's very important to think about contraception right away. Normally it takes a little longer, for most women, because the sort of the hormones have to change back, and then the regular cycle has to start again. So mostly it's more like 5 weeks after the abortion when the first menstruation will come again. But it might be after 4 weeks already, or earlier. Often it's like more 5 weeks. It can take longer as well. What we know is that unplanned pregnancies happen to all age groups, all social groups, all types of people. And as soon as you have heterosexual sex, there's always the possibility of being pregnant. No matter what you do, because there's no 100% safe way of contraception. Yeah, and what we do know is that most women who have an abortion are between 25 and 35 years. Half of the women who have an abortion do have one or more children already. And what we hear here is that I have the idea, or the idea, I don't have really data on this, that most women who become pregnant unwanted do use some method of contraception. Yeah, and it's just never absolutely safe. And we see women here with IUDs, and we see women here with Kupferkette, and we see women with all sorts of methods, and still pregnancies to happen. But the idea that women just don't care and then they are pregnant and just go for an abortion, that's just not true. Yeah.
Yes.
Yeah. And in Germany, the number of abortions is very low.
Okay.
Yeah. Well, Pro Familia is the biggest NGO working on reproductive health in Germany. And we are sort of all over the place with lots and lots and lots of centers, and the easiest way would be to go on the internet, and there's a Pro Familia website, and you can enter your postal code and go and look for the next counseling center. Yeah, and at the moment we are sort of things changed with the pandemic situation, and we do offer counseling in person, via video chat, and also via telephone. Yeah, so you don't, if it's difficult for you to come here, you can contact the centers. I don't know if all centers in Germany offer all options, but basically it's possible. And there's other counseling possibilities apart from Pro Familia as well.
Thank you for watching this video until the end. Don't hesitate to follow us on Instagram at Magic Ovaries. And if you don't want to miss any upcoming video, subscribe to this channel. Ciao, ciao.